Many people feel safer going to the beach than a hospital, and that can create some new health problems. What if you need emergency care? Dr. Thomas Divina Gracia, Chief of Vascular and Endovascular Surgery at Hartford Hospital, and Maureen Schiller, a patient from Niantic, are both joining us right now. Thank you for being with us.
Thank you. Thank you for having us.
Thank you.
Maureen, I want to start with you. You needed life-saving surgery, but you were actually hesitant to go to the hospital since it was during the peak of the pandemic. What finally convinced you to go?
Well, the level of pain that I was dealing with. And I must say, my daughter, who ended up calling the emergency room to find out what the procedure was, and she convinced me that everything would be okay, and off I went.
Yeah.
They were wonderful. Everything was, it was Easter Sunday, so.
Wow. Okay. Yeah, that was, I understand that so many people have been trying to avoid the hospitals, but doctor, we know that can have its own risk, especially if you need care. How did you help Maureen feel safe?
Well, fortunately, Maureen and I have had a clinical relationship for several years, but we had a good conversation on the phone, and I think she understood how serious her problem was by the time we spoke on the phone. Her pain had progressed, to a point where she really was in a lot of trouble, and I think she understood the gravity of the situation, and I think our discussion helped alleviate some of her anxiety. And then I think we got her here, and I think the staff and everybody was very attentive to all of her needs and to try to help allay some of her anxiety as well.
Maureen, we have in our final moments with you. Tell me, did you feel safe once you got there, and how are you doing now?
I felt very safe. Well, I was in good hands. Dr. G had treated me for years, and I was glad that I could be in his hands. I knew he would fix it, and I'm feeling quite well now. I'm back on a regular diet, and I'm back gaining weight.
Good for you. Doctor, your final message to people out there is if they need help, it is safe to go to the hospitals, and they absolutely should get emergency care.
Yes, yeah, it's understandable that people have anxiety coming to the hospital, but I think as we learn more and more and the hospitals and the staff adapt appropriately, the hospital is a very, very safe place to come, and we don't want people to forego getting care that they need. But yes, the message should be that if you need care, please come, and we'll take good care of you.
Thank you for your time, Doctor. And Maureen, we're so happy you're doing well.
Thank you.
Thank you.